As parents, it can be scary when your child is first diagnosed or showing signs of autism. Instead of being scared, we should be jumping on the bandwagon to help our children as early as possible, with or without a diagnosis, and with or without a therapy team. But how do we get over that fear to help our children have the best outcome? I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author. Each week I share some of my tips on turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Today I'm sharing a small excerpt from a podcast interview I did with Dr. Melanie Pellechia, a researcher from the University of Pennsylvania and a board certified behavior analyst. Dr. Pellechia talks about parent involvement in early intensive therapy and the best possible outcomes to help you get out of denial and fear and start helping your child. Now that the rate of autism is so high, when Lucas was diagnosed back in 1999, the rate was thought to be 1 in 500, and now it's closer to 1 in 50, depending on which study you look at.
Sure.
1 in 58, 1 in 40. And so there's such a high rate. There is less stigma attached to getting diagnosed. There's much more proof that early intervention is really key. And to get intensive intervention, a lot of times you need a diagnosis. There's a very long waiting lists for developmental pediatricians. And so, one of the goals of my online course is to provide to parents and early intervention providers some real good strategies, ABA, evidence-based strategies to start making progress without a diagnosis, with or without a diagnosis, with or without a team of professionals. Because I really do think that starting with the Lovas study published in 1987, as well as many of the other subsequent studies that shows that the power of ABA is a lot of times it is also a big factor is the dedication and time commitment and of a parent, usually a mom. Yeah. Do you have any, are you in touch with any research, or have you done any research to show that moms or parents in general have a big part in that, best outcome rate?
Yeah, so it's actually what I'm currently researching right now. And so I have an award that is funded through the Institute of Education Services, through IES, and an award that is hopefully going to come through from the National Institute of Mental Health. Both are looking at how early intervention providers working in the 0 to 3 system are able to support parents of children who either have autism or who are at high risk for going on to get an autism diagnosis. And so I think what you're keying onto is this notion, which we're seeing a lot in the literature, about parent-mediated interventions and parents being empowered to support their child's development. And that doesn't mean they become their child's primary therapist. We certainly don't think that's the case. But I do think that there's a lot of research showing that parents who are able to learn a lot of the strategies that are going to help their child be successful are more empowered, have a higher self-efficacy. The parents have less stress. And then we see better outcomes for kids because they have parents who are now able to support their communication development all day long instead of just the 10 or 15 hours of therapy time that they're getting. And so if the parents are integral parts of that intervention, then we're seeing a lot of gains. And so my research is in figuring out the best ways to implement those kinds of parent-mediated interventions within the community settings. Because what I'm learning is that although a lot of early intervention providers are certainly well-intended and support families as best they can, I think there are some evidence-based parent coaching strategies, some evidence-based strategies that we know can affect change in parents' behavior, which would then affect change in their child's behavior. Those often aren't implemented in community settings. And so trying to help early intervention providers teach parents as opposed to working directly with the child for the bulk of their session. And so how can we collaborate with parents during sessions? How can we coach them and model and demonstrate and then have the parent demonstrate some of these skills in a way that would show that they were able to implement them successfully, I think is something that we see is lacking in a lot of the early intervention systems, and hoping to change that.
Yeah, I think that's a big issue. I know one of the members of my online course, my toddler course, early on, she was driving. She finally got her son off the wait list for speech therapy, and she drove him 70 miles away to her appointments. Wow. And the speech therapist's policy, this is a 2-year-old with no language, the policy was that the parent couldn't come back into the room. She was told to wait in the waiting room. The child was, having separation anxiety, didn't know this person, screaming the whole way back. I mean, she was literally told, some parents just go shopping. And this woman it was in my online course. That's not my belief. We need to partner with professionals, and parents need to partner together. That's why everything I do, my book, my podcast, my videos, my online courses are for both parents and professionals, because it's we need the expertise of the professionals, but we need the power of the motivation of the parents and the fact that they can provide that 24/7, kind of therapy strategies. It's so. And the other point to that is, just because you can get speech therapy, ABA, whatever, and just because it's funded doesn't mean it's that person or that place is the right fit. And then parents have to navigate that system. They just got off the waiting list, and now they're met with resistance and lack of collaboration. And it's just I could tell you stories from hundreds of members of my online courses of frustration that it's just we need to leave our egos at the door. Everybody should just be worried about the child making their best progression.
Yeah, I totally agree. And I think something similar that I always tell parents who are navigating the new, time of when they're getting services for their child is that they should be involved, and they should ask to participate in sessions. And if they are going to someone that says you're not allowed to come into the room, then I might, question that and say, why, and how can I help my son if I'm not allowed to watch what you're doing? How can I learn what you're doing? And I think that empowering parents to be able to ask those questions and to know that they're okay, it's okay to ask those questions, is really important. And it's a time where I think a lot of families are just so excited to get service that they don't want to question those kinds of statements because of fear that they won't be able to keep that service, which we certainly we shouldn't be doing as professionals.
If you enjoyed this episode, I hope you give me a thumbs up, share this video, leave me a comment, and I hope that if you are interested in learning more about how you can join my online course and community, you'll go to marybarbera.com/workshop. And I hope to see you right here next week.